It's 102.7 and 103.5 WICY, your feel-good favorites from the 80s and more. John Kazar with you, and joining us from Alice Hyde Medical Center is not Dr. Todd Whitman or Matt Jones. It is nurse practitioner, pediatric nurse practitioner Jennifer Shull. How are you, Jen?
I'm doing great. How are you today?
Good. I just want to know about, your time with Alice Hyde, how long you've been there, and what is it that you do exactly?
I've been with Alice Hyde 1 year now, and I am a pediatric nurse practitioner, so I get to see our kiddos in the community from birth all the way up until they're adults.
Yeah, so you weren't there very long before COVID hit and shook things up a little bit, huh?
Correct.
Yeah, and I'm not sure if they really prepare you for this type of stuff, but how has it been overall?
Overall, I think we have done some wonderful alterations to our office, our staff, and we are really well prepared to meet the changes that the pandemic has brought on.
Yeah, dialing in here to pediatric office visits during the pandemic. Elaborate.
So, obviously, parents are concerned and anxious about keeping their children safe during the pandemic, but we want our kids in the communities to be up to date on their immunizations and wellness visits, as those are critical to our children's growth and development. So I highly encourage parents to keep those wellness visits and keep those child immunizations on track. And part of those wellness visits, we can catch on developmental, social, and emotional concerns early on as parents have those. So keeping those immunizations up to date helps keep our children healthy and safe from serious illnesses. And many providers in our community have changed the way we deliver our care to ensure we are protecting those patients and families. Both myself and Dr. Ordonez have, we've taken away the waiting room aspect, so parents are not coming into contact with each other in the office, and
Right.
we are using telehealth as well.
Mm-hmm. I've heard great things about telehealth and its success over the course of the past 6 months. It's been crazy,
Absolutely.
Or so, 6 months. It feels like a year and a half. But either way, right? Let's get to children and masking. It's an interesting kind of fine line issue, isn't it?
Absolutely. So I think it's important to know that children under the age of 2 should not be wearing a mask. However, with that said, our older children, we need to get them accustomed to wearing masks and cloth face coverings as well. And one way we can, help them become more comfortable with that, because kids do see those masks as, strange, uncomfortable. Sometimes they're even scared of them. So we really need to meet them at their level and, use your adults to do role modeling, show them that they are safe and it's healthy to use those. So one of the big things I like to do is allow the kids to have fun. So use the imaginations that they have to help them become comfortable. So let them play at home with them, act like they're superheroes, which often our superheroes wear masks.
Mm-hmm.
Allow them to pretend to be a doctor or a nurse or another healthcare provider. Let them kind of direct where they are and let them become comfortable and, give them ownership as well. Let them pick the mask out. Let them pick the fabric if you're going to make a mask, or let them decorate, put glitter, put stickers. Let them make it their own and give them praise and positive, aspects. And, if you see your kids struggling with a mask, tell them, hey, I see you're having a hard time. Let me help you. What can I do for you? And that really lets them direct the mask wearing.
Right. No, I love the idea of the superhero and getting them integrated that way. Whatever we can do to get their mindset more of understanding why we kind of need the masks or just to get them to use it, I guess, is the bottom line. Right.
Absolutely.
Awesome. Well, okay. Is there anything else, Jen, that you want to add with us today? It's been a great conversation.
I don't have anything else to add. I was really excited to do this today.
Yeah, we have pediatric nurse practitioner Jennifer Shull with us from Alice Hyde, and it was a welcome surprise to have you on, but it was a great addition. Thank you so much, Jen.
You're welcome.
All right, we're inside the community here on 102.7, 103.5 WICY.